Hello, my name is Mitch Broom. I am a speech-language pathologist in Lakeland, Florida, and I am currently graduating from USF with my master's in speech-language pathology. And today I'm going to be presenting on cognitive rehabilitation and seizures. So today's objectives, we are going to look at the etiology and symptoms of seizures to give you a basic overview. We're going to analyze the research behind cognitive rehabilitation for patients with seizures. We're going to discuss the benefits of cognitive rehab for patients with seizures, and we're going to look at the next steps for research. This is an ongoing, continuing education that cognitive rehab is something that needs to continually be improved and looked at, and to improve the evidence-based practice behind it. So for the definition of a seizure, according to the DSM-5, psychogenic non-epileptic seizures are classified as a form of conversion disorder or functional neurological symptom disorder, with the term functional referring to an impairment of normal bodily functioning. So to simplify this, the functional part basically means that there is an abnormal brain function that is happening, and that is the symptom of the disorder. So there are a couple different classifications that we're going to go over for seizures. And this is how they are broken down, and they are broken down into further categories, and we'll talk about that in a few moments. So as far as the overview for the classifications, you can have what is called a partial, which is also called a focal seizure. So this could occur in a specific area of the brain. So for example, the right hemisphere only of the cerebral cortex. The next category is called generalized. So this is a seizure that can occur simultaneously in multiple areas of the brain. So this is something that may only happen for a few seconds, or it could be up to a couple minutes. The final one is unspecified, and the reason they talk about it like that is typically it only happens in infants, and it's at a very, very young age. So we're not going to focus on that one today. So as far as the types of seizures, and we're going to get into the symptoms as well. So this is a table that kind of demonstrates the breakdown further in detail. So there can be a couple different variations of the partial seizures, and several for the generalized as well. So for the partial, you can have simple or complex that can evolve to different, even secondary general locations. And then as far as the primary generalized, there are several different ones. We're not going to go into detail about those, but this can give you kind of an overview of the different types that are diagnosed in a patient that presents with a seizure. So as far as some of these symptoms that you are going to experience in these, so for a partial, typically there may be some sort of impact in sensory input or sensory information during that time, motor and psychogenic, and even autonomic functions. So for example, that could be hearing, smelling, vision, or balance can be affected, or a combination of those. Consciousness may or may not be impaired. So typically there is a understanding of I'm aware of what's happening in this. That may not be accurate all the time, but it can kind of fluctuate between the two. For the generalized, there are typically gaps in consciousness, and this is one of the areas that differentiates the two. There may also be a postural change in the muscle tone. So relaxed muscle tone in the face, or even a specific flex of the muscles, maybe in the face, in hands, different things like that. And this can last for a couple of seconds, or it can last for several minutes. So it can be totally understandable where this can be quite concerning with someone with seizures, that they have lost their consciousness or do not recall the event at all. So this is definitely something to kind of acknowledge and understand about people that deal with seizures. So as far as the etiology or the cause of seizures, there can be a wide range of etiologies. So there is difficulty with controlling the excitatory and inhibitory neurons in the brain, resulting in abnormal brain function. So all of the neurons work in tandem and work to balance out what neurons are being activated and what neurons are being inhibited or pushed, the electricity in those neurons not being active for a certain moment to focus on a certain skill. So for example, the basal ganglia focuses on smooth movement of motor function. So for example, being able to snap or formulate your hands in a certain position, that can be inhibiting the other muscles from being activated during that time. So there can be, this is what's working in tandem. And so when these are firing both at the same time, or there is too much input, this is what can result in the seizure. Think about it. Another example would be you get a muscle cramp after working out or going for a long run. That neuron is continuously firing in your calf, and so it's spasming, right? So it's firing when it's not supposed to. So that is kind of an idea, it gives you an idea of what is happening in the brain. So as far as the causes, there can be a wide range, like I said. So this can be due to a traumatic brain injury. So for example, a car crash, gunshot, even just a simple fall. All of these can kind of trigger a seizure event occurring. It can also be due to stroke or a neurogenic disorder. So it can be a comorbidity paired with a form of dementia or Alzheimer's disease. There can be a genetic link and or a structural defect. So all of these can be different causes for seizures, and as well, there can be more as well, but these are some of the primary ones that are found. Now, a negative to the understanding of seizures at this point is in the majority of patients, about 70%, a cause is not found. So it may be diagnosed that there is a seizure that occurred, or that seizures are occurring, maybe for epilepsy, which is recurring seizures, that is being shown now. But as far as finding the cause of it, that is sometimes very difficult to diagnose. As well, the occurrence, the onset of seizures occurring, whether that be one specific seizure or epilepsy, recurring seizures, this can be a wide range. This can be starting very young, at a child's age, or developing due to a TBI later on in life, or a stroke when you are in your 70s and 80s. So there is a wide range of when this can occur. As well, to give you kind of an idea of how many people are affected, roughly 2.5 million in the US are going to be affected each year by seizures and or epilepsy. To give you an idea, that's about 50 for every 100,000 people that deal with epilepsy. And there is about 250,000 that will experience a seizure each year, the very first seizure. So a seizure is a single event that may not occur, that may not reoccur. It can be a one-time event. And so experiencing that can be very traumatizing for sure. And it also can be something that does not occur again, but because of that onset, it's very difficult to diagnose. So let's get into the cognitive rehab side that works with seizures. So cognitive rehabilitation is activating the neuroplasticity of the brain to improve cognitive function in daily life activities. The goal is to make the treatment translate to your real world life. Okay, that is the goal of the treatment. So the 5 areas of cognition that cognitive rehabilitation works on or focuses on is the areas of attention, memory, language, executive functioning, and visual spatial skills. Those are the 5 pillars of cognition. There's research that suggests that cognitive rehabilitation can be beneficial for patients with seizures. And this also can be true for patients with epilepsy. Some of the research that we'll talk about later includes both in their studies. And so that's a good thing to understand, that it's not something that for someone who has just experienced 1 or 2 seizures, it can also be for someone with recurring seizures. Benefits to learning rehabilitation strategies and compensatory strategies are huge for this, because a lot of the times the most effective treatment is a combination of both. You want to be able to continue and maintain the current cognitive ability that you have, and as well, if cognition has been affected significantly, using compensatory strategies to help deal with daily activities and overcome some of those cognitive difficulties is a great benefit for patients with seizures. And cognitive rehabilitation has been researched in many areas, working with different patients that have experienced a TBI, a traumatic brain injury, stroke, aphasia, multiple sclerosis, and other disorders as well. So cognitive rehabilitation is a global umbrella term for working on cognition and different treatments that can be helpful for these different neurological disorders. So some of the research that I'm going to discuss, this first study is back in 2002, and I know that's a long time, but this is to give you an understanding of how long cognitive rehabilitation has been studied. It has been studied much earlier than this, but this gives you an idea of the cognitive rehab. It's relatively young in its stages as treatment, but there is evidence to support that it's beneficial, but there still needs to be research on it. And I'll kind of explain that more in depth as we go along. So for this study, this looked at patients with focal seizures. So this one focused on people that had partial seizures. And this could also include seizures or epilepsy that occurred. There was a total of 44 patients in this study, and this study is a randomized controlled trial, which is one of the better practices for using evidence and in a study. So this one broke it down into 3 different groups. There was a control group that did not receive any cognitive rehabilitation. There was a group that was administered a retraining method. And then there was a group that was administered compensatory strategies. So for this study that was done, the retraining method used different rehearsed responses in an attention task. And as you progress, the difficulty and complexity increased. So this was developing, improving attention and increasing the difficulty as you went along. For the compensatory strategies, you were promoting awareness that there are difficulties in their daily life with this. And so what you went over were different rules of how to compensate in those difficult tasks. So it wasn't so much working on the neuroplasticity of the brain and trying to retrain. The goal was to compensate for the difficulty that is currently there. So in both areas, there were positive effects with both groups when compared to the group that received no cognitive rehabilitation. With this, one of the biggest things that improved was quality of life. So after the study was over, a 6-month follow-up was done, and for the 44 patients, quality of life was one of the biggest things that improved. And so what this demonstrated is that the retraining and compensatory strategies allowed for the patient's quality of life to improve. And there is some evidence because of this that there could be some long-term results, long-term benefits from using these different methods. So, and both had benefits in the areas of cognition. It wasn't statistically significant which group benefited more, but both showed increases in their ability to improve in what the tasks that they were working on. Another study that I want to discuss, this one was done in 2015, and this one focused on cognitive rehabilitation with patients that had epilepsy surgery. So some sort of resection or area of the brain had been removed where the seizures were present. So this one is what's called a systematic review. This is the highest level of evidence in a research study that can be done. So this one looked at 577 patients. So obviously a much bigger sample size. And this included 4 studies that met their criteria of what they were specifically looking for. So the patients did demonstrate improvement in the areas of verbal memory, attention, and psychological function. There were a couple other areas measured. Those were not attributed to the cognitive rehab that was done. Those other areas that improved were contributed to the surgery that actually took place. And one of the things that they were really looking for in the criteria was, were the improvements due to the surgery or were they due to the cognitive rehab? And so this study did a really good job of differentiating the two. And so that's why there was very few studies that actually met the criteria for it, even though there's a larger sample size, which is a good thing. So the results were mixed due to some of these improvements, like I said, being due to the epilepsy surgery. This one, there were areas, verbal memory and attention and psychological function were the 3 that improved due to the cognitive rehabilitation. So there are some benefits to doing this in tandem with some sort of surgery that may be appropriate for the patient. That is another treatment option that occurs for people with epilepsy. So it's something that can be used in tandem after that occurs to help with maintaining current cognitive function. And also with patients that are older, we have to think of it, there is some natural atrophy that occurs, as well as different medical conditions such as stroke or things that can occur later on or more likely to occur later on in life. Using cognitive rehabilitation in those facets helps you maintain your cognitive function for a longer period of time. So that is, even though we are just maintaining, we are not regressing, we are not, we are still we're able to maintain. And so that is a benefit in and of itself. So some of the benefits that were talked about in these studies was patient education to help understand the current difficulties with cognition. Oftentimes with patients with seizures or epilepsy, there is a little bit of confusion as far as what they were diagnosed with, the different classifications of the seizures and everything like that. Being able to educate patients and help with their understanding of what's currently going on with their maybe short-term memory or their attention skills is very beneficial. So that way, being able to promote awareness is a great thing for helping them understand how to deal with what's going on. Some of the other things that were benefits for them were using memory supports. And this was internal memory support, so writing things down, using repetition of words, repeating things over and over. Association, maybe connecting it to prior knowledge, or visualizing. These were some of the things used in cognitive rehab that can be very beneficial. Also, they wanted to use external memory support, so a journal to log friends and family, things that may occur during the day, so that way it's easier to recall at a later time. Using a calendar would be another example of an external memory support to help you keep things organized and appointments and things like that. There was a big improvement in quality of life with cognitive rehabilitation. And like I said previously, with this treatment approach, we're able to access the neuroplasticity of the brain. And so this has great benefits because the brain is able to rework itself, remanipulate those neurons that are in the brain to be active. And the more we're able to concentrate on those neurons and refocus those neurons to work in our favor, that is a huge benefit for a person who's working on their cognitive skills. And the final benefit that I wanted to mention are strategies can be used to help facilitate independent activities of daily living. So IADLs for short. These are any way that this treatment approach can affect the independent activities of daily living. So whatever you are doing in your life, how can this treatment approach help with you facilitating what you typically do on a daily basis? So as far as the conclusions with this research and just the overview of seizures and everything. So research is vital when using evidence-based practice. As a speech-language pathologist, we want to be grounded in what we are doing in our treatment approaches for patients. Using evidence-based practice needs good quality and a large amount of research behind it. And so this is one of the things with cognitive rehab that is continuing to grow and continuing to improve. There is evidence, and it's the best evidence we have right now of a good evidence-based practice. That's why there is a lot of input and a lot of push to use it with patients with seizures, but that evidence still needs to be developed. Cognitive rehab, like I said, requires more research. And as well, this is ongoing with seizures and epilepsy as well, not just the treatment. There, like I said previously, 70%, there is not a diagnosis or a cause found for seizures. So there is a lot of ongoing continuing education going on in the medical field currently with seizures and epilepsy to understand them more. So just with that side of it, the treatment needs to be understood more as well. Using rehabilitative and compensatory strategies are beneficial for patients that have difficulty in the areas of memory, attention, visual spatial skills, executive functioning, and language. The 5 pillars of cognition, using a combination of rehabilitative and compensatory strategies, are very beneficial for the patients. Like I said as well, there's evidence to support that it improves quality of life and even in a long-term setting as well. And the final goal of cognitive rehabilitation is to help patients with, like I said previously, their independent activities of daily living. We want to be able to focus and just translate this to what you are doing at home. And that is a good treatment approach is able to generalize it to your home setting, because that is the goal. If you're not able to take it from the therapy room into your home and daily practice, there really isn't much benefit for it. And so that is one of the big positives with cognitive rehab at its current status. I want to thank you for listening, and I hope this was beneficial for you understanding cognitive rehabilitation and how it relates to people with seizures and epilepsy. I hope it gave you a little bit of information as far as understanding what happens with seizures, what's the classification, and what that kind of involves when it relates to a person's cognition or memory. And so I want to thank you for coming. Like I said previously, my name is Mitch Broom. I am a speech-language pathologist, and I am currently graduating from USF, and I hope you enjoyed this presentation. Thank you.